This podcast is part of the Frederick Podcast Network. Learn more at listenfrederick.com.
That's number one. You kind of reset me.
Painful, tender to the touch. May also
Same shoulder length, and the other.
One study looked at 158 patients with severe COVID. They gave half of them 10 milligrams of melatonin only once a day in addition to standard care. The other half was the control group. They received standard care but no melatonin. The researchers reported, in comparison to the control group, thrombosis, which is blood clotting, and sepsis developed, which is infection in the blood, developed significantly less frequently in the melatonin group during the second week of infection, while mortality was significantly higher in the control group.
Gosh.
And this is just the tip of the iceberg, he says. They can lower blood pressure as well. And we're going to talk about some of these things like heart failure. It's so interesting. It says melatonin can lower blood pressure, fight heart failure, cancer, reverse osteoporosis. But you have to know how much to take and when to take it. Melatonin is also good for your teeth, which is a big surprise.
Well, that's good, as people are starting, counties or municipals are now finally starting to pull fluoride out of the water, which, while it may help prevent decays, it's not doing great justice to your body.
Yeah.
So now we can just replace that with melatonin.
There you go.
Much safer.
Let's put melatonin in the water.
It's not a byproduct of bomb making material, so they don't need to get rid of it.
That's right.
So there's no financial incentive to do that.
Yeah, it talked about plant-based melatonin. I want to know what plants they're talking about. There's no melatonin plant.
Mm-mm.
So I want to find out. Maybe that's another thing you look up. Find out what plants have melatonin. I think a lot of foods have melatonin in them. I did look it up years ago.
Well, keep talking. I'll see if I can find
Okay.
anything.
A lot of dental problems can be helped by melatonin. It acts to decrease periodontal inflammation, protect against reactions to dental materials, and improve healing after dental surgery. Autoimmune diseases is one we haven't talked about yet. The only autoimmune disorder that has been studied so far as it relates to melatonin is multiple sclerosis, or MS. Every time a patient with MS suffers a relapse, melatonin production just happens to be decreased. In one study, researchers gave 102 patients with MS a daily melatonin supplement for 90 days and then measured quality of life scores along with markers of inflammation and oxidant stress. They reported higher quality of life scores and a marked decrease in both disease markers.
Just to go back, melatonin has been identified in feverfew, and St. John's wort. So those are two herbs. Apple, barley, bean, cucumber, grapes, lupine, maize, potato, rice, and tomato, among others. But those are some of the big ones.
Look at that. Once again, it proves an apple a day keeps the doctor away.
Yeah. Actually, coffee robusto, coffee Arabica. Am I saying
Arabica?
that? Arabica. There we go. Black pepper, wolfberry, white radish, white mustard, black mustard, curcumin, wolfberry, Burmese grape, fenugreek, almonds, sunflower, fennel, alfalfa, bitter melon, green cardamom, flax. That's amazing. Some of the big ones, though, the coffee, those two were very high levels. And black pepper actually is very high levels as well.
Filet mignon doesn't have a lot of melatonin in it?
It's not on my list,
I was
sir.
really hoping
We could probably sprinkle it.
All right, blood pressure. Improvements in blood pressure have been reported after as few as 2 months of taking melatonin in 30 patients with metabolic syndrome. 4 other studies have shown that melatonin improves both systolic and diastolic blood pressure, reduces arterial resistance in the internal carotid artery, which says the arteries in your neck, decreases platelet aggregation, which is tendency to clot, and decreases nighttime high blood pressure. It also reduces the adrenaline levels in patients with high blood pressure. Which is why people take beta blockers.
Yeah.
Is because the effect of adrenaline on their adrenergic receptors. Look at this. I mean, and it's not like it's one study. There's four, so total of 5 separate studies that talk about this.
Yeah.
Heart failure. Recently published review says the authors review the amazing amount of data regarding the effects of melatonin in heart failure. They state melatonin improves outcomes in patients with heart failure and is considered a preventive and adjunctive curative measure in these patients.
Can we just talk about those 3 terms they just used?
Preventative,
adjunctive, and curative.
Mm.
That's big time when you're talking about heart failure.
I agree.
If anyone hasn't had a family member who's dealt with that, the meds that they put someone on with heart failure to try to balance what's needed in the body is very difficult. It's a difficult balance to find.
So you got to wear compression socks to get the blood back to the heart. You take medication that's supposed to increase contraction of the heart, which I can't imagine adding longevity to the heart when it does that. And then they probably put them on blood thinners to reduce clotting. And this said melatonin does the same thing. I mean, and that's just a little bit. They probably put them on cholesterol meds as well.
It's just crazy.
Just for the heck of it. I don't see why, but they do. Anyways, one way to assess the degree of heart failure is with a blood test called proBNP. I believe that's a peptide.
Okay.
That's released when there's damage to heart cells. The higher the don't quote me on that. I think that's what it is. The higher the proBNP levels, the worse the heart failure. So it gets released by heart cells, I believe, and it's a peptide. Researchers have discovered that the more melatonin a patient with heart failure has, the lower the proBNP levels, which means less damage to the heart cells.
Yes, and it's exactly what you said.
One randomized double-blinded placebo-controlled clinical trial found that taking melatonin supplements for 24 weeks improved endothelial function in patients with heart failure. That means increased blood supply to the heart cells. Come on. Just 24 weeks of taking melatonin. There are no less than 11 experimental studies on the clinical effects of melatonin in animals with heart failure. Melatonin reverses the major factors causing heart failure, including oxidative stress, apoptosis, necrosis, fibrosis, and pathological remodeling, which is faulty heart tissue repair. You know, we have a friend who gets AFib a lot.
Mm-hmm.
Gotta get her on some melatonin.
Yeah.
Goodness. And now let's talk about GI disorders, because that is common. And this next paragraph, I think, was my favorite of all of this.
Oh, yeah?
They're right here.
Let's hear it.
It says, in the stomach and intestines, melatonin acts to increase and protect the integrity of the mucosal lining, so important for preventing leaky gut.
Which is a huge problem.
Which leads to autoimmune diseases, guys.
Yeah.
Leaky gut causes... Oh, I'm getting too excited.
And food allergies.
And yeah, exactly. Exactly. It also improves the circulation to the intestinal cells, stimulates the regeneration of damaged intestinal cells, and improves regularity for optimal detoxification. I mean, if you just told me those 2 sentences right there, I'd be taking melatonin right now, which I will be.
It's on order.
Melatonin has also... You ordered some?
Mm-hmm. Yeah, I actually did some research to see, because I'm really picky about the...
Did you get the plant-based one?
I'll look and see. There, at the time, I wasn't looking at plant-based versus...
Because the plant-based, they said, was, 50 times more effective than the synthetic?
I'll look and see. I first looked at the manufacturers or the labs that were creating supplements that they actually pay to do their testing, because regardless if it's plant-based or not, if the company is not willing to put their money where their mouth is, they're not getting my money.
Correct.
Do you know what I mean? So one lab that we work with very closely, and I've always loved their products, is Designs for Health.
Yeah.
And they are actually one of the top rated ones. So that's who I'm initially ordering from, and we'll see how that goes.
Are you going to share?
Maybe. I would never try to out-health you. I will share with you.
When we talked about the health gap in women last time, or two episodes
What,
ago.
so you're saying I have some catching up to do?
There's actually another thing I saw in the news about the health gap in women, where like generally health span in women is less. So anyways, why don't we both get healthy?
I'm not claiming that, sir.
Forget about it.
That is one study I am not
It's
owning.
other women. That's right.
It's other women.
Those other women out there.
Those other husbands' wives.
Yes. Not mine.
Nope.
Melatonin has also been attributed to increasing the tone of the lower esophageal sphincter. So the sphincter is that muscle that contracts that keeps food from coming back up into the esophagus. So food goes in, stays in. I
wonder if that helps all sphincters, because we have more than one sphincter.
We got a few. Yeah.
I'm just saying.
I was going to tell a joke, but that's not appropriate.
Any sphincter not functioning properly is problematic, I would think.
Yeah.
So maybe it's a sphincter strengthener, which is also a tongue twister.
Say that 3 times.
I'll let Sean practice that.
It's hard to say esophageal sphincter to begin with, but anyways, it increases the tone. It is a decrease in that tone that can be responsible for heartburn and reflux symptoms. One study of GERD, which is gastroesophageal reflux disorder, showed that taking melatonin for 8 weeks worked just as well as the reflux drug omeprazole.
What?
Nice. And omeprazole causes osteoporosis, but melatonin prevents osteoporosis. Giddy up.
Rock and roll.
I think we're going to name our 4th child Mel. If it's a girl, it'll be Melly.
So good we can't have it anymore. But that child who's looking to be adopted, watch out.
Your name's getting changed to Mel or Melly, depending on if you're a boy or girl.
Funny. Grandchildren. We have grandchildren in their future. So
there you go. Our first grandchild can be Mel.
We can call it whatever we
remember
want.
that show Mel's Diner?
Yeah,
that's the only Mel I know.
That.
Do you know any other Mels?
Well,
I mean, we know Melvin, but he doesn't go by Mel.
I know some Melissas that I always called Mel.
Oh, there you go.
So
they can go by Melly. Melatonin in the stomach and the esophagus acts to protect against and heal inflammation and ulcerations. Researchers gave patients with stomach and duodenal ulcers either melatonin placebo or the amino acid tryptophan combined with omeprazole. At the 21-day mark, those treated with either tryptophan 250 milligrams twice daily or melatonin 5 milligrams twice daily had no ulcers, while the placebo group had 3 gastric ulcers and 3 duodenal ulcers. The body uses tryptophan to produce melatonin. Cool. The tryptophan
very cool.
Is found in turkeys.
I'm so glad you said that, because I was thinking that just a second ago. I'm like, can we just eat some turkey and some melatonin and call it a day? Don't give it to the
dog.
Oh my gosh. Yes. We made that mistake with one of our boxers.
We gave turkey to one of our boxers.
We thought we were being kind.
She liked eating it, but she wasn't happy afterwards.
That dog literally was rolling around moaning.
Until she passed some gas.
Yeah.
Loud, stinky gas.
It was bad.
Bad.
We never gave her melatonin again.
Not melatonin.
Tryptophan. Turkey. You'll have to edit
we
that.
should have given her melatonin.
That's right. That's funny.
Don't give your boxer turkey. That amount of gas that dog had.
We didn't even give her that much turkey.
No, it was like a little piece.
Yeah.
Never again. Research indicates that our intestinal bacteria have a circadian rhythm just like we do, and respond to melatonin. This allows the bacteria to synchronize with our circadian rhythm. Because of its interaction with our intestinal bacteria, melatonin helps with regularity and in maintaining a healthy microbiome. I mean, how many times are people talking about the microbiome being responsible for illness, disease, all that stuff?
Well, we know that our immune system starts in our gut, so
There you go.
all of that's tied together.
Published studies show that melatonin can improve symptoms of pain, bloating, loose stools, and constipation in individuals with irritable bowel syndrome. In one study, 50% of patients given melatonin for 6 months had significant improvement in their constipation. All the published studies on melatonin and IBS have shown significant improvement in abdominal pain and quality of life scores. Then there's the C word. Cats. No. Contacts.
Capricorn.
Capricorn. No, the other one. The other astrological sign.
Cancer.
Oh, yeah. Cancer. The early research was on patients with solid metastatic tumors. So we're not talking stage 1 or stage 2. Like
Right.
things don't metastasize till stage 3 and 4. So this is advanced cancer. Research showed that high doses of melatonin were effective in stopping tumor growth and improving quality of life markers. Stopping tumor growth. Come on.
Some may say, well, it didn't get rid of it. You ask somebody who has a tumor that has been shown to be
Right.
growing whether or not they would consider that a ginormous win. I guarantee you most would pray for that. Most would
It's
hope
like
for that.
the episode we did on ivermectin and cancer.
Yeah.
So,
But like this is easy to get. You don't need a prescription to get this.
right.
You just need to get it from the right lab
Yeah.
and the right dosing. But wow.
Tiny Tim at the street corner has some. Anyways, in one study, the researchers treated 54 patients who had cancers that were not responding to conventional therapy. Most of them had either lung cancer or colorectal cancer. Melatonin was given by injection at a daily dose of 20 milligrams at 3 p.m. for 2 months. Here's what they found. 3 patients had minor responses. 30 of them rapidly progressed despite the melatonin. 18 had improvement in their quality of life, and 21 patients saw no progression of their cancer. Overall, 44% of these very difficult cases, which were not responding at all to conventional therapy, showed significant improvement. 44% is almost half of them.
That's huge.
Keep in mind that cancer is not a problem unless it is growing. So it is an amazing finding that 44% of these patients saw their tumors stop growing.
Huge.
Also, keep in mind that you would need to take 10 to 20 times more melatonin orally in order to get the same blood levels that happens with injecting melatonin. So they got injected
20 milligrams.
20
right?
milligrams, so you would have to take 200 orally
Right.
to have the same effect. But man, if I had cancer and it wasn't responding to anything, I mean, if I had cancer, period, I'd be on this stuff. I'm going to be on this stuff regardless if you share some with me.
I'm going to.
No, you ordered it. So, one study in 50 metastatic lung cancer patients, again, this is advanced cancer, indicated that taking 20 milligrams of melatonin starting 7 days before chemotherapy resulted in a better response to the chemotherapy.
Of course.
Another study looked at 50 patients with metastatic lung cancer. The researchers gave them 20 milligrams of melatonin at bedtime and compared how well they did to 100 similar patients who did not take melatonin. All the patients were taking chemotherapy with cisplatin and gemcitabine. What are those? The tumor response rate in the melatonin plus chemo group was twice that of the chemo-only patients. Twice. So it worked twice as well. The chemo, these drugs I just read, the gemcitabine and the cisplatin, worked twice as well.
Yeah.
With melatonin.
Well, I mean, if you're saying that melatonin it's actually working and necessary at a cellular, a mitochondrial level, Well, what is chemo doing?
Hmm.
Right?
Right.
It's killing every cell in the body.
Right. And then we did read earlier that it affects cell apoptosis, which is cell death. So
Right.
there you go. It's
So
literally causing those cells to die. The authors said, in conclusion, the efficacy of chemotherapy may be enhanced by the pineal hormone melatonin by representing a new promising biochemotherapeutic combination.
but why does he say may?
I know. Basically,
I mean, it may in more than 40%.
basically, melatonin improves chemotherapy results while at the same time decreasing toxicity.
You know what I'm not seeing? I'm not seeing any negative
This one wasn't
effects.
44%. This was everybody. All
Yeah.
of the ones that were doing chemo and melatonin,
had an improvement.
all of them showed double the improvement compared to the other group.
So then the question is this. When did these studies come out? And why?
Well, they've been doing it for 30 years, it says. Scientific research regarding melatonin as a treatment for cancer goes back at least 3 decades.
So then my question is for all of these oncologists.
1990s, they've been doing this.
So here's my question to all oncologists who are not using it. What the flip?
They have no idea.
How do you not have any idea? These
Well,
are the research
because they
studies in your area.
But they don't get their education from these types of articles.
But that's their fault.
They get their education from ads
Okay.
and reps.
Okay.
These reps dress nice, put on makeup,
I don't
walk
care.
into the doctor's office, bring lunch,
I don't care.
right? And then they say, if you prescribe this, the company, the manufacturer, the big pharma will send you to Hawaii for a continuing education seminar. You sit in a classroom for 1 hour. You get to hang out in Hawaii for a week. By the way, bring your family and kids. Everyone's going to have a good time.
Yeah, I understand that, but here's what I'm going to say. Nope, you do not get to use that as an excuse. If you are treating people with cancer and that is your area of study, then by golly jeepers, you better be doing your own research because it's not coming from big pharma, and you all know that because you're smart.
This is
So
why
stop
people
it.
don't trust their doctor.
It's so annoying.
We have trouble gaining trust of our patients just because of that. You know, but at the same time, times are changing because I'm getting text messages from parents of our kid patients who say, hey, I know I'm not your patient, and I talked to my primary care already, but I trust you more.
Right. What
Why?
do you think about this?
Why? Because I don't make money prescribing drugs, and I don't get kickbacks from those drug companies, so they trust us more.
That's right. It's mind-blowing. Like, if you know that there's a supplement as simple as melatonin, it's cost-effective for the patient and is going to improve their outcomes with chemo. At this rate, we're not even saying, Mr. Oncologist, please don't prescribe chemo. That's not even the conversation. The conversation is if 100% of your patients, yes, I'm talking directly to you. If 100% of your patients are going to do better with combining melatonin, then what the flip? Just do it for the love of Pete. And if you are a patient who is going through chemo, then ask for it. Actually require it.
Yeah.
Because you have the right to do it. Ugh.
Yeah,
it's annoying.
But you know, with all the legalities and everything, either way, talk to some kind of healthcare professional before you start taking.
Well, that's why I said talk
melatonin.
to them.
Just-
Require that you get to take it because
Exactly.
they need it injected.
Yeah. Yeah,
Ugh.
it's true. So now there's osteoporosis. Osteoporosis is when
Ooh, I
bone
need to
density
calm down.
decreases and people break their bones easily.
Mhm.
Elderly, a lot of elderly have that. And remember, we said this earlier, taking a lot of those antacids causes osteoporosis because it causes malnutrition because you don't absorb your food
Yeah,
properly.
not
So
to mention a lot. That's the effect of many medications, which we know the stats on what
By the
they're
way,
taking.
off topic, we used to always think osteoporosis can be prevented if you lift weights. And now we found out that's not the case.
Mm.
Lifting weights, walking is not reversing osteoporosis. Do you know what does reverse it? Impact, jumping.
Wow.
So you should jump, like you should jump rope, you should do jumping jacks. You need impact in your bones to increase osteoblastic activity
Yeah, the challenge is for a lot of women,
or osteoclast.
right? For a lot of women who are dealing with osteoporosis, jumping is really hard for us
Yeah.
because many of us have had kids and
Yeah.
we have urinary incontinence.
Yep.
So if that is the case, come and talk to us about IMSALA. There are potential ways, if you're a candidate, to be able to help
Absolutely.
strengthen that pelvic floor.
Yeah, AMSOL is FDA approved for incontinence, pelvic floor strengthening, and it's easy and
That
cost
FDA approved thing
effective.
is for you guys who actually think that matters.
You think that's important?
We
yeah.
don't find it that valuable, but we know some people
Which
do.
is funny because it's not a food or a drug. So why are they approving it? All right.
Okay.
Osteoporosis. One study looked at 81 postmenopausal women aged 56 to 73 who had low bone mineral density scores. For 1 year, they treated 20 of the women with 1 milligram of melatonin per day. Another 20 were treated with 3 milligrams per day. The rest got the placebo. Compared to the placebo group, the women getting the 1 milligram dose had a 0.5% increase in bone density, and the women on 3 milligram dose had a very large and significant 2.3%
That's
improvement.
huge.
This is in 1 year.
Yeah.
How incredible is that? And listen, osteoporosis is progressive.
Yeah.
So if
hard to slow it down.
if this guy said all it did was stopped the progression of it, their bone density did not get worse,
That would have been impressive.
I would have been impressed just by that.
Right.
The fact that it improved by 2.3% with only 3 milligrams a day,
Because they're not really finding anything else that does that.
right?
So
No, I mean the drug they give does that, but the drug they give reduces plasticity of or flexibility of the bone, which causes it to fracture easier. It becomes a dry twig as opposed to a healthy
So then you go,
branch.
what's the purpose?
Don't ask me. Melatonin works to improve bone mineral density in at least 2 ways. It stimulates stem cells to turn into osteoblast cells, the cells that build bone up. At the same time, it decreases the activity of the osteoclast cells, the ones that act to decrease bone mineral density. Another study found that the bone building effects of melatonin were increased when it was combined with strontium, vitamin K, and vitamin D supplements.
Just amazing.
So, let's talk about how to take melatonin.
Let's do it.
Inquiry minds want to know.
I want to know. We age ourselves sometimes.
That's right. What was that publication?
What was that?
Inquiry.
Inquiring Minds.
The National Enquirer?
The National Enquirer.
Is that what it was called? It was trash, right?
Oh yeah. Yeah, I think it was.
talked about like,
Does that still exist?
I don't know.
The National Enquirer? I don't know.
Inquiry minds. To date, even though researchers have been trying for decades to discover the toxic dose of melatonin, they have not been able to find it. Think about it. Why are they they're spending all this time trying to figure out how toxic can it be? Let's give them this much.
Wish
this
they
much.
do that on half the drugs they put out.
Seriously, why don't you find the toxic dose for all your drugs? Well, because the toxic dose is any amount.
Like, well, let's not cover that.
It's all toxic. Additionally, taking melatonin does not in any way cause your body to stop making it.
That's cool.
Yeah.
Because I think that was something that was on your mind long
Yeah.
ago, wasn't it?
Right. Well, yeah, because everything else, like when you take like testosterone, your body stops producing testosterone.
Right.
So, even though melatonin is free of toxicity, it can have minor side effects in a small number of people. The side effects consist of having vivid, often disturbing dreams, waking up feeling drugged, or interrupted sleep. Fortunately, these side effects stop immediately upon either stopping the melatonin or reducing the dose.
That's nice.
So if you start having crazy
So
dreams,
if you have crazy dreams and you don't enjoy that,
yes,
I mean,
you might like it.
I might have fun with it. So I like vivid. I think vivid dreams could be fun as long as they're not like scary or dangerous.
Yeah. You can be Wonder Woman in your dream.
Ooh. So fun.
One factor that impedes the sleep-inducing effect of melatonin is taking naps.
Uh-oh.
So you can't take naps.
I don't really take naps.
I take a nap. I just took a nap, actually. Maybe I won't need the naps anymore. I don't know. For melatonin to be an effective sleep aid, it requires a minimum of 12 hours of wakefulness before taking it. But, okay. But that's if you need it for sleep. I don't have any trouble falling asleep,
Correct.
so I can take my naps.
I think you'll be fine.
The other issue with taking melatonin for sleep is light, especially the blue light that comes from TVs, computers, fluorescent lights, and cell phones. Make sure that you stop using any of these devices at least an hour before taking melatonin. One study showed that after 7 nights of wearing blue light blocking glasses for 2 hours before bed, people with insomnia had significantly improved total sleep time, sleep quality, and soundness.
I'm getting me some. I forgot
I
about
have
blue
some.
light glasses. You do? I don't have
At the
any.
other office. Remember one day you came in, you're like, what are those?
Yeah, they were
That's it.
nice.
You liked it?
Yeah, they were cute.
Exactly. On average, oral melatonin reaches maximum blood levels after 41 minutes. That is a weird number, 41 minutes.
Well, it works for the airlines.
Yeah, I guess so.
So maybe that's how they make sure the melatonin is
What,
on time.
Like if it's 42 minutes, you're like, you're late, melatonin. Get in there. Taking melatonin several hours before bedtime has the effect of inducing sleep earlier. Taking it during the day tends to make you sleepier later. Taking caffeine during the day increases the sleep-inducing effect of melatonin. Graveyard workers should take caffeine during their shifts and then take melatonin when they get home after work. And to combat jet lag, take caffeine during the day and melatonin 6 hours before and again 1 hour before bedtime. See, I wish I knew that when we went to Bali.
Yeah, no kidding. That was
Literally took
painful.
us 36 hours door to door to get there.
Yeah.
And then we were completely discombobulated because 6 p.m. here is 6 a.m. over there and vice versa.
Yeah. I mean, even traveling back and forth to Iran when we used to do that was...
Iran's 8.5 hours.
It's still... That's a lot for the body to comprehend.
Oh, yeah. And then
So-
just, our sleep was all messed up. Because what is it, like 8 hours to get to London, right?
Yeah.
And then we took a 13-hour flight to Singapore. And then it was another couple hours to Bali. And we had all those layovers in between.
Yeah, that was a long... But at least Singapore, at least those airlines are more cognizant of comfort.
That's true.
Like even...
Oh, yeah. Singapore Airlines, we didn't fly first class, but their first class cabin has a queen-size bed,
Yeah.
a butler, and a private bathroom.
But even their economy class, you still had the footrest.
That's right.
You had more
It
leg
reclined
room.
more,
It
yeah.
reclined more. So
It was pretty good.
it was good service.
Yeah. It was like a JetBlue first class seat
Yeah, ish.
or something. Or a, what is it? Southwest. Southwest doesn't have first class.
Business class.
It does? Oh, okay. Well, now here comes the plant-based melatonin is superior in every way to the synthesized version. Plant-based melatonin inhibits the pro-inflammatory enzyme COX-2 646% more
Yeah, definitely need plant.
than synthetic melatonin. It also inhibits free radical molecules 267 to 470% more than synthetic melatonin.
So plant is the way to go.
Plant, yep. According to the researchers, the reason plant-based melatonin outperforms synthetic melatonin, even though both forms are exactly the same, is because of the other constituents that come with the plant-based version. So it's the supporting cast that makes it. It's the same with movies, right? You got a great actor, but if the supporting cast sucks, that's not a good movie. But if the actor is great and the supporting cast is great, it's a great movie.
Well,
so it's the supporting cast. It's
it also
other
goes
ingredients.
back to the whole fact of, if our creator created these things knowing what our bodies needed,
Yeah.
right? You're always going to do better going with natural versus synthetic.
Exactly, folks. That's everything. That's vitamin C, vitamin D, vitamin E, everything. The natural form. I mean, remember the study we talked? I think we talked about this when Dr. Keppel was here. We talked about wheat germ oil.
Yeah.
Like the vitamin E in wheat germ oil increases your stamina. The vitamin E in like another oil did something totally different,
Totally
even though it was. They're both vitamin E.
Yeah.
But if it comes in this, it does something else than if it comes in something
Well,
else.
it's actually very similar in my brain to when you eat raw vegetables versus cooked vegetables.
Yes.
Like your body needs both, because it when you cook something, it changes the
It
molecular
does.
structures
Yep.
of that thing, and so you get different nutrients from it.
Right.
So that's very important.
Says they focus particularly on chlorophyll, beta carotene, lutein, and other antioxidants found in plant-based melatonin.
Mm.
Producing plant-based melatonin is not practical, though. You would need 50 pounds of plants in order to extract just 1 milligram of melatonin.
Oh, that's so sad.
We got to talk to God about that one. Why didn't he make the plants more potent? Can we just have a melatonin tree?
It would be so nice.
Just one tree. We just eat the melatonin directly off the tree. Make sure you have a healthy diet consisting of a variety of plant-based foods along with supplements. Like they talk about some immune supplement here to augment the effectiveness of the melatonin. We have to look that up. And then resveratrol and EGCG found in coffee and especially in green tea have also been reported to improve the effects of melatonin.
Oh, so take your melatonin with green tea.
Yeah.
How about that?
And resveratrol is in red wine, right?
Yeah, I think it is.
And red yeast rice or something. The physiological dose of melatonin is defined as the dose that gives you the same amount of melatonin that the pineal gland makes. It is 0.5 to 1 milligram. However, as I reported above, the total amount of melatonin being made in the human body is upward of 200 to 400 milligrams per day. And remember, he said you only have 5% of that left if you're over 55.
Right.
Typically 1 milligram for every pound of body weight is what he's recommending. So today I weigh 166.
Good job.
So tomorrow it'll be
So
different.
you need 166
166 milligrams of plant-based. So multiply 166 by 50 pounds of plant. That's a lot of plant.
Well,
We have to kill a lot
he's
of
not
trees.
saying plant-based at this point.
No.
He's saying, I mean, you're not going to get it at
But he's saying 1 milligram per pound of body weight is
Right.
entirely safe.
Yes.
And in animal studies, these high doses prevent just about every disease associated with aging, including Alzheimer's, osteoporosis, virtually every form of cancer, heart disease, death from viral illness, and macular degeneration. Come on. I'm taking it.
Me too.
I mean, I haven't aged in 20, 30 years, but if I decide to ever age,
This is why I'm going to take triple so I keep up with you.
keep up. Keep up. Although that's because I nap and you don't. I'm telling you, it's not a nap, it's a beauty rest. Keeps me beautiful.
Yes, you are beautiful.
Sean laughed at that one. Although melatonin is made in the pineal gland and in spurts at 2 a.m. and 2 p.m., it's likely all day long in every cell in the body. Therefore, taking melatonin should not necessarily be something that we only take before bedtime. Taking it during the day can also be helpful in certain cases. In my cancer patients, I often recommend taking very high doses 4 times a day upon awakening, before lunch, before supper, and before bed. Several
Wow.
studies have shown that the melatonin supplements on the market contain anywhere from only 5% to a whopping 170% of the melatonin listed on the label. So it is important to get it from a reliable source.
That's just amazing stuff. It's very exciting. So we're gonna be testing this out personally, and we'll let you know what we see and what we find in ourselves. And if any of you guys out there decide to do any testing with melatonin, please let us know you're going to do it, and then let us know how things are going. Journal, why you've decided to take it, the list of maybe things you're hoping to remedy or see changes in, and then make sure you document that. I always tell people, you got to put your private investigator, your Sherlock Holmes hat on, so that you can really pay attention to the changes that are occurring in your body and document that. I think it's super important. We'd love to hear the results.
Absolutely. Well, I think that was great information. Sorry it took so long to finally get through this, and
Yeah.
and we kind of wanted to talk about it last week and the week before, and it just, but it was worth it. I think it was worth it.
I'm
This
excited.
could be life-changing. This could be powerful. This may be one of my favorite episodes.
And the great news is they may not see a difference in the timing,
Right.
because I think we may reverse how we post this. So
Okay.
they may actually see right after the first episode where we talked about it, they'll probably see this pop up. So
Okay. Well, there you go. Well, we'll let Sean handle all of that, and we'll field any questions you guys have. But please continue to tune in, as we will continue to bring you information, and hopefully we can help you in many ways. I think it was a good podcast.
I liked it. I'm excited.
Yeah. 100th episode coming up.
Woohoo!
Take care, everybody.
Bye-bye.
This podcast is part of the Frederick Podcast Network. Learn more at listenfrederick.com.